Fasting is an ancient tradition that's been used in many different societies and religions. In recent years, it's been ingrained into diet culture through different forms like time-restricted eating and alternate day fasting. Intermittent fasting has been shown to improve memory and heart health, as well as reduce the risk of obesity. And while most people think of fasting as a water-only diet, Dr. Walter Longo says there are nutritional programs that can mimic the effects of fasting without completely cutting out food.
There are ingredients like sugars and proteins, for example, that give the signal to the human body that you're eating, and so you have to stop the fasting response. There are foods like fats, especially certain type of fats, that don't give this signal, right? So then the body responds to, let's say, a high-fat diet, low-calorie, high-fat, low sugar, low protein. It responds to that as if it would be water-only fasting, right? So you get an equivalent response. It may take maybe a day longer of a fasting-mimicking diet compared to a water-only fasting to get the same effects.
Longo is a professor of gerontology and biological sciences at the University of Southern California. He says the effects of fasting are much more impressive than simply weight loss. In fact, Longo reveals how it's revolutionizing cancer treatment in his new book, Fasting Cancer: How Fasting and Nutritechnology Are Creating a Revolution in Cancer Prevention and Treatment. Cancer is extremely hard to treat because one tumor is made up of many different cells that may all react differently to a certain drug. However, the one common factor is that they all need nutrients to grow and thrive. So when cancer patients begin a fasting-mimicking diet, or FMD, it confuses the cancer without harming the healthy cells.
All the normal cells, in a very coordinated way, know exactly what to do as you're starting to fast, as you continue your fast. The cancer cells don't know what to do because they've never seen that before. And they try, and they've evolved with excess food, right? So cancer cells have always seen a lot of sugar, a lot of proteins, a lot of amino acids, a lot of everything, right? So now all of a sudden, they don't see that anymore. They don't sense that anymore. And so they become desperate and they start rewiring.
Cancer is very good at adapting, so once that initial confusion wears off, it'll begin to steal nutrients from healthy cells. However, when the fasting-mimicking diet is used in combination with a cancer treatment like chemo or immunotherapy, it catches the cancer in a weakened state before it's able to adapt.
You have to time it for that reason, so you have to make it go long enough, but you also have to time it because you don't want, for example, the refeeding moment to be associated with a lot of drugs, especially chemotherapy, in the blood of the patient, right? Why is that? Well, as you shrink, as fasting occurs and the body shrinks and goes into a protective mode. But then when it refeeds, it starts rapidly proliferating. A lot of cells start rapid proliferation and to get back to the pre-fasting status, right? So in this rapid proliferation, you don't want the chemotherapy to be at high levels, right? So this is why we always tell patients don't improvise, because it's more complicated than you think.
In fact, consuming food right after chemotherapy could do more damage. So the timing of the fasting window is important, and the requirements change for different drugs, which is why it's so important for the oncologist to be overseeing every step of this practice.
Somebody's getting hormone therapy. This is not what I just said. It's not really a problem. And the timing is not that important because this is given continuously. So most patients that we follow and they are receiving hormone therapy, they will just do 5 days of a fasting-mimicking diet once a month. And as long as it's once a month, it doesn't really matter how it's timed with the drugs. Whereas, with chemotherapy or radiotherapy, that's very important.
We have decades of research on fasting and fasting-mimicking diets that show it can be a really effective addition to a cancer patient's treatment plan.
For triple-negative breast cancer, there are enough studies where they're already showing overall survival. And so patients that combined chemotherapy with fasting-mimicking diet, the overall survival was nearly doubled, right? And so, these are small studies, but many studies have been done, all indicating for metastatic triple-negative breast cancer treatment that the trial suggests an improvement in survival in the FMD plus chemotherapy versus chemotherapy alone.
Still, Longo notes that a fasting-mimicking diet isn't for everyone. It's up to the patient's oncologist to decide if this intervention is safe and the right choice for their treatment plan. Since this nutrition plan drastically limits a person's caloric intake, some people may not be a great candidate if they're already underweight or have kidney or liver damage.
If somebody, let's say, had severe liver damage, they might not be able to sustain the fasting plus, let's say, the chemo or some other drug, right? So yeah, it may be killing a lot of cancer cells, but it's hurting the patient.
However, the reward could still outweigh the risk depending on the severity of organ damage. Longo says the oncologist can put a patient on FMD for a day while closely monitoring their liver or kidney response to see if it's a sustainable option. In addition to the positive results seen with highly aggressive and advanced stage breast cancer, this treatment method has been shown to cause regression in lymphoma and colorectal cancers in animal studies. Based on current research, FMD also helps make therapies like chemo more effective while reducing its toxicity to patients.
Not just chemotherapy, now we have data, for example, making immunotherapy less toxic, making kinase inhibitors less toxic. For example, kinase inhibitor cause hyperglycemia, and the fasting-mimicking diet brings down the hyperglycemia. So yeah, that's been tested for. Now, a lot of data is positive, very little data is negative, so that's good news, clinical data, I mean. And then I think one thing that we heard from almost every patient, let's say the great majority of patients, is the empowerment.
Oftentimes, a cancer diagnosis can feel like a massive loss of control for the patient. Even though the disease is attacking from the inside out, the most they can do is listen to the doctor's advice. Longo says many of the people he's worked with feel like this diet allows them to be an active participant in the fight against their cancer. Despite the positive research, FMD isn't yet part of standard care, but it's not for a lack of trying. A few years ago, Longo worked with 11 top hospitals on a $20 million grant proposal. They wanted to do a formal trial of hormone therapy plus FMD with 500 patients. Unfortunately, their proposal was denied both times they applied. He believes the lack of progress could be due to an inherent favoritism of drugs in the medical field.
We've been funded very well by the NIH for animal studies. But I think when you get to clinical studies, there is a lot of resistance, right? Because, the clinicians dismiss it and they don't see how this could be comparable to the drugs.
Even though the current research shows it actually enhances the effect of the drugs. Longo says that many physicians are trained to think of drugs as the first line of defense, so accepting that nutrition can be just as effective in some cases is proving to be a big obstacle.
There's few exceptions. There are some universities now that are having nutrition and lifestyle much more at the center of the medical education. But the great majority of medical schools don't have that. And then, this is one of the biggest businesses in the world, right? And so if you have a nutritional intervention, now this could mean that the next drug that somebody spent $1 billion developing may not be used because now you have a better, cheaper solution.
That's not to say that he believes this research is being actively shut down, just that there's an ingrained ideology in the medical field that needs to be changed before nutrition will be taken seriously. Thankfully, smaller trials are being conducted all over the world, and if the results continue to be positive, the body of research will continue to grow until it becomes undeniable, a win for oncologists and patients alike. Longo founded a nonprofit called Create Cures Foundation, which can be a great resource for anyone interested in a fasting-mimicking diet. It provides information on nutrition plans for various conditions like cancer, autoimmune diseases, and heart disease. You can find more information about Dr. Walter Longo and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.